So right there, though, I can't get the binder on the thing. Okay. Work for me.
Regarding the school lunch program, and given the fact that we had decided to close our schools, we wanted to ensure that those young people that were dependent upon the school lunch program would continue to have those resources available. And I was alerted just yesterday that over 120 school districts are currently operating under that scenario, with almost 360 locations around the state of Mississippi feeding through the school lunch program. On March the 19th, I took additional action as it relates to our schools by closing them until April the 17th through executive order. I said at the time, and I'll continue to say it, that was one of the hardest decisions I've ever had to make. Since being elected to office almost 17 years ago, I've made a lot of hard decisions. That was one of the hardest because I understand the impact that has on Mississippi families. I understand how difficult it is from a child care perspective, particularly for those that are in essential services, our healthcare workers, our doctors, our nurses, our nurse practitioners, and others. But I did it because I believed it was in the best interest of Mississippi and the best interest of Mississippians. At the time that I chose to do that, that extension was one of the longest closing of schools in the entire country. It sent a message to Mississippi and to Mississippians the importance of taking necessary action during this unprecedented time. On March the 20th, we had requested and we received notice from the U.S. Small Business Administration that we would be approved for SBA loans for our small business owners. You all know that small businesses are the backbone of our economy in Mississippi. They are the backbone of our economy in America. And while these times are challenging, they're particularly challenging on individual workers that work at small businesses, and they're particularly challenges for those who have dedicated their life to starting a business, developing a business, growing a business, and contributing to our economy. And I am so pleased that the U.S. SBA has approved that, and we're going to continue to work with small business owners to make sure they get the help that they need. Then on March the 21st, I took action to take away barriers to unemployment benefits to those who find themselves unemployed. Historically in Mississippi, and I think long term these are good policies, but for times such as these, we had to relax certain things regarding employment benefits. For instance, there is no longer a requirement that an individual wait 1 week to apply for unemployment benefits in Mississippi during this crisis and during this state of emergency. Thousands of calls, and I commend those who are working those phone lines every single day. The Mississippi Emergency Management Agency has delivered more than 210,000 surgical masks across the state, and we have delivered more than 236,000 N95 masks. We have worked with federal officials, worked with President Trump and Vice President Pence and their team to encourage them and to receive PPEs from the national stockpile. We have utilized the PPEs that we have in store at our state stockpile, but understand that both of those, while massive, are not unlimited. And because of that, we have gone out, we have worked through the traditional supply chain, and we have secured significant additional masks that are going to that have either come in over the weekend or will be coming in the days and weeks ahead. But I do want to encourage all hospitals, to all emergency management officials. We're going to do everything in our power to utilize the open market and to utilize the current supply chain to provide more and more PPEs. But I encourage you to do the same. Please, if you are a hospital, utilize your current existing contracts to try to purchase more supplies. We are all in this together, and we have to all work to make this a reality. Every county EMA in Mississippi now has personal protective equipment from the state for our first responders. We have had daily meetings with our emergency management team, with health officials, with our local partners, as well as with our federal partners. We just secured, after requesting from HHS and CMS, a Medicaid waiver to use more funds to combat the outbreak and best care for Medicaid patients in Mississippi. I will tell you that many of the bills that have been currently passed in the Congress, at least the two supplementals, there is the potential for us to get an additional FMAP contribution from the feds, and we're working through that process as well. We have worked with the State Department of Revenue, Commissioner Herb Frierson, himself a former Appropriations Chairman in the House, with Speaker Gunn, with Governor Hosemann, in ensuring that we deferred the state tax deadline from April 15th back to May the 15th. We have increased unemployment protections. We have secured paid leave for many workers. We have mobilized testing sites across Mississippi, and we have done so by doing things like shutting down certain sectors of our state. Obviously, from government offices that are non-essential to our schools, and I understand that we also saw the Gaming Commission shut down casinos. Again, all of which were in compliance with the recommendations given to us by the CDC as well as with the Mississippi State Department of Health. During this time, we have worked to issue clear guidance. That guidance continues. You must stay home as much as you can. Do not go out if you can possibly avoid it. Do not hoard supplies. We have assured you, as we have been assured by the President and others, that the supply chain is working. The supply chain is delivering groceries every single day. Our amazing Mississippi truckers and our amazing American truck drivers are working to ensure that those shelves get restocked. That is something that we must continue. I have to tell you, please do not hoard. This is not a time for panic. This is a time for caution. Listen to the experts, because I will tell you that is exactly what I am doing. Every decision that I have made has been based upon advice from the experts. My commitment to you is to continue to listen to them to protect all Mississippians. Those experts also advise, do not gather in groups of 10 or more. Use good hygiene. Reserve our test for the most vulnerable amongst us. If you are an employer, whether you're a government employer or a private employer, please allow workers to go home if they are non-essential and can work from home. When we talk about testing, it was made very clear on the call yesterday with the Vice President and the COVID-19 coronavirus response team that testing if you do not have symptoms, you do not need to be tested. If you do not have fever in excess of 100.4, you probably do not need to be tested. If you are amongst the more vulnerable populations, and let me just say, the more vulnerable populations are those over the age of 65 and those who have compromised immune systems. So if you are currently undergoing cancer treatment, for instance, please stay home. In addition to that, I will tell you that we have a detailed pandemic plan. We have world-renowned experts, and we have a well-stocked, though not infinite, supply of PPEs, etc. Later today, I do plan to sign an additional executive order that instructs Mississippians to avoid non-essential gatherings of 10 or more, that tells all restaurants and bars to suspend dine-in services, again following the lead of the State Department of Health, using drive-through, pickup, or delivery to get people food. It will direct Mississippians not to visit hospitals, nursing homes, or long-term care facilities, again working to protect the most vulnerable populations. It will direct businesses to allow every possible employee to work from home. and it will ultimately define essential businesses to give clear guidance to our partners at the local level should they decide to take additional action in their communities based upon the potential for local knowledge. I have committed to transparency through this process, and I will continue to offer transparency. Understand that we are not at the end of this pandemic. In fact, we may still be at the beginning stages of this fight. The virus is new. We do not know what the future holds, but we do know that this virus is not to be taken lightly. We have emphasized that from day one, and as the data comes in, we will understand that even more. In conversating yesterday with the call with other governors and our federal partners, there is hope that the 15 days to slow the spread of virus that the President instituted some 8 days ago and concludes on Monday of next week may be having the intended consequences. But we don't have enough data yet to know that for sure. As that data continues to come in and as the CDC and others continue to monitor that data, we will have more information to make better, more informed decisions. We also know that every action that we have taken to date does have unintended consequences. Every action echoes through our communities, affecting thousands of people's ability to earn a living. It affects thousands of families, and it affects thousands, if not hundreds of thousands of lives. These decisions have been amongst the hardest of my career. I am hopeful that we do not have to choose between the effects of this virus and the potential for abject poverty coming out of an economic disaster. Our health experts tell us that is not the case, and I trust them. I make you a solemn promise. I will take every action that our experts tell us will protect Mississippi's most vulnerable citizens. That is my job. I will make hard decisions, and I will do what's right for the people of Mississippi. Now, as I conclude, I want to thank all of you for heeding the call to take action, to stay home, to wash your hands, to practice social distancing, to not gather in groups of 10 or more, to protect yourselves and protect your neighbors. And in addition to that, I want to thank the literally hundreds of thousands we'll ever know. All of us are in this together. Those of us up here, the staff in our hospitals, the truckers on the road, and the workers in our stores. Those of you in the media, thank you for the way in which you're covering this pandemic. Thank you for providing information to our constituents, to our fellow Mississippians. Thank you for the job that you're doing. We are all in this fight as one unit. In the 4th chapter of Ruth, verse 14, we read, "Who knows whether you have come to the kingdom for such a time as this?" I believe in God's providence, and I believe that He placed every nurse, every worker, every teacher, every reporter, every grocery bagger, every parent in our positions for such a time as this, because our state and our country need all of us to do our parts. Be smart, because we do not know when this will end, but have hope, because we do know we will make it through. Thank you, and I'm going to ask Dr. Dobbs to come give some remarks.
Good morning, and thank you, Governor Reeves. I would like to just share how incredibly supportive and thoughtful the governor's been, and our political leaders taking this so very seriously, making sure that we're thoughtful about every step along the way, trying to protect lives in Mississippi. Just an update for today, we are reporting 71 new cases, bringing Mississippi total up to 320. So we expect to see continued increases in cases over the next days and weeks, although we're doing everything we can to figure out how we can stop the spread of this virus. We're working very closely with other healthcare partners, trying to enhance the capabilities of testing. And if you go to our website and see in other publications that there are more and more options for getting assessed for COVID and also getting testing. And we're really excited also that the community health centers across the state have joined the fight, and every community health center is going to offer assessment and testing, especially for those who are uninsured or maybe need additional financial support. We're also working with health centers to make sure that we enhance capacity such that if we do see a surge of cases, if we do see a surge of hospitalizations, if we see excess need for intensive care units or ventilators, that we have an ability to rapidly increase that capability. This is something that we're working on very aggressively because we do not want to have a situation in Mississippi where we have to make life and death decisions based on the supply of ventilators or ICU rooms. That's something that we take very, very seriously. I would like to implore everyone to please follow the social distancing guidelines. We're still seeing pockets of people clustering together in ways that would promote transmission. If you're piled up outside of a retail store trying to get supplies, that's not social distancing. Please do everything you can to stay out of congregated groups. We have reports of people still congregating in mass around weddings, around funerals, and going to church. I know our faith is very important to us, but part of this is for our neighbors, and if we really love our neighbors, we will make sure that we honor these best practices because we have seen significant outbreaks of disease when people in faith communities have gathered together, and we've seen pretty remarkable outbreaks. So please, just for this period of time, honor these social distancing guidelines. That's all I have to say, and just thank you all for your support.
Thank you, Dr. Dobbs, again. I can't speak highly enough of Dr. Dobbs and his team. We have been in constant contact for many, many, many days on end. That includes Saturdays and Sundays, and that includes nighttime. It includes really late at night and really early in the morning. There are a lot of brave Mississippians that are working day and night to help protect our fellow Mississippians, and I couldn't be more proud of their efforts. And so with that, we have a number of people here, including Director Michelle with Mississippi Emergency Management Agency, as well as General Bulls with the National Guard, as well as the Department of Public Safety. And so as we open the floor to questions, I'll be happy to answer any questions that I can for as long as I can, but also I will bring in the experts if there are specific questions that need to be asked.
Governor, there's been so much chatter, for lack of description, about whether the state should be put on, quote, lockdown. Is that an option? How much further will we have to go to be at that lockdown definition?
Well, I'm not going to rule anything out at this time. We're going to take every step that the experts ask us to take to protect Mississippians. As I mentioned yesterday, I was on a call yesterday with Vice President Pence, with Dr. Birx and others, and I specifically asked the question, what is the federal government contemplating with respect to a national lockdown, and what do they suggest in places around the country? In addition to that, I've had conversations repeatedly with our health experts in Mississippi, and I have not been advised by anyone to enter into a statewide lockdown. There are currently 18 states that have varying degrees of lockdowns, but I will tell you that the vast majority of them that I have been made aware of, including the one in Louisiana, I have had conversations with Governor Edwards. Governor Edwards has a unique challenge in the city of New Orleans, obviously. I don't believe that Mardi Gras festivities helped a whole lot in February with respect to the gathering of a lot of people that had the virus, unbeknownst to most. But Governor Edwards, in his remarks, was very clear that the police aren't going to pull you over and ask you where you're going, even though he has a stay-at-home order in place. And so what I believe is that the majority of Mississippians are heeding the call to take care of themselves. As Dr. Dobbs mentioned earlier, I believe that we do have some pockets where that has not been the case, and we are, again, that's the reason we're looking at an additional executive order later today. But we are telling all Mississippians, avoid groups of 10 or more. Funerals, weddings, etc., because the spread has happened. We actually have instances where there were people that we know that were infected that attended either a wedding or a funeral, and that led to additional spread of the virus. And so this is a ever evolving crisis, one that is changing day by day. My commitment is to listen to the experts, but at this time we do not see that as the best course of action to see a statewide lockdown. Now, there are those in various cities that are doing certain things to take measures that are even more stringent than what we have already offered. What I will tell you is when the Vice President was speaking yesterday, one of the things he was very clear of, what the case is in the state of New York and the current situation in the state of Mississippi are very different. That is true. And so each leader has to make decisions based upon the best information that they have at the time available. And the best information I have right now would not call for a statewide lockdown. Yes, sir.
You gave a number yesterday about the number of hospital beds available in the state of Mississippi. Now, based on the percentage of individuals with COVID-19 who require hospitalization and the length of time from incubation of the virus, what is the number of affected individuals that would suggest we're headed for a collapse of our healthcare system or the inability to provide ICU beds for everyone who needs hospitalization?
Well, obviously, and I'll let Dr. Dobbs speak to this as well, but obviously the implications of overwhelming the healthcare system is the very reason why we have taken such aggressive action to date. It is very clear that older patients that enter into the hospital that need respirators, etc., we have better successes at saving those patients when they have that ability. You look at what's going on in the state of New York, for instance. The federal government is moving. In fact, the Defense Secretary Esper announced earlier today that they are moving hospitals on Navy ships into New York, into California. We are nowhere near a situation such as that in Mississippi. But I will tell you that we are taking action today to and in the days ahead to prepare for the potential of putting more hospital beds into the system in Mississippi. Governor Edwards asked yesterday if the President and the Vice President and the U.S. Army Corps of Engineers would help retrofit some facilities in New Orleans, for instance, to provide for that. I think you'll see us in the coming days tour some potential options for Mississippi should we get to that. We don't expect that we're going to get to that, but we're going to prepare for it. My goal is always to prepare for the worst, pray for the best, and expect somewhere in between. And that's what we're going to do in this scenario. Dr. Dobbs, would you like to address that?
You know, it is a very serious concern and something that we've been really planning around for a long time. You know, we're looking at certainly tiers. We want to make sure that people have access to the absolutely best health care they can, find areas for expansion within the existing healthcare system. There is a lot of capacity to use some creative thinking about adding care to existing sites, hospitals, and this is one of the reasons why we put out the directive to back off of elective surgeries, right? So that we open up some of that space, but also there's a lot of underutilized space when you're not doing those sorts of things, where we can use PACUs and things like that. But beyond that, we're looking at adding other capacity. A lot of our hospitals, if you've noticed over the years, the bed counts have dropped, so there is, in some areas, there's underutilized physical structures that we can tap into. But then if it gets more extreme, then we're looking at more extreme options and other things we can do to support the health system so that it can function as best it may. Certainly we don't want to overburden the staff and having approaches to that as well. Thanks.
Last week, the health department reported, I think, 24% of the patients requiring hospitalization. Is that percentage?
I don't have today's numbers, but that's been about right. That's been pretty consistent. Yes, sir.
Can you characterize it on 71 new cases today?
Yes, sir.
Are we going to be looking at larger increases? Crystal ball question, I acknowledge. Or are we looking at what we're expecting to
We will see more cases because we're going to do more testing. There are a lot of undiagnosed cases out there today, and that's one of the reasons why it's so important to practice social distancing for everyone, because we don't know who has it and who does not have it, especially people with milder disease. As we ramp up our testing and lower our thresholds as the supplies become more available, even if there are more cases out there, we will see more cases reported, for sure.
Hold on 1 second, if you would. I want to comment on that question regarding the 24% of hospitalizations, because that is an accurate number, as Dr. Dobbs has said. But let's remember that we are prioritizing testing for those who have significant fevers, for healthcare workers, for those that are with compromised immune systems, those that are in the high-risk categories, those that are already hospitalized. And so I don't think when you're looking at numbers, particularly given the 350-ish cases that we have today, I don't think that those numbers really would hold up relative to the number of cases that actually exist. And so just to be fair, I don't think that you're looking at 1 in 4 people who ultimately have contracted the virus are going to need hospitalization. So that's where we are today. But again, remember that we are prioritizing testing for those most vulnerable and most sick. Sorry about that, Courtney.
I know that you mentioned that every state is different. A wallet study came out today examining different factors, and Mississippi is 51 for states that were least aggressive in fighting coronavirus. You mentioned every state is different, but what do you say to people at home who maybe are worried because they're seeing what's happening elsewhere and wondering if it will take the numbers, hitting a certain number before they see it?
Well, what I would say is that we have been very aggressive at providing guidance to Mississippians. The reality is, if you're sitting at home right now and you are concerned, what I would encourage you to do is to follow the guidance. Stay at home. Make sure that you are protecting your loved ones. If you have loved ones who are in that vulnerable category, if they are over 65, if they have compromised immune systems, figure out a way to go out for them and provide them groceries and shop for them. Don't gather in groups of 10 or more. That's just something that we have been advising for weeks on end, and we're going to continue to advise. And in fact, we're going to continue to see what we have seen, which is the vast majority of Mississippians are actually adhering to that. You know, given where we are in this crisis, and I'll let Dr. Dobbs speak to this as well if he'd like, but given where we are in this crisis, a lot of the new tests that we are now seeing positive results from had it long before any of the social distancing, before the president came out with his 15 days. And so this is one of the things that was made clear by the doctor in our call yesterday with the White House Coronavirus Task Force, is sometime middle of this week we should have caught up from a testing standpoint nationally, such that the new data that's coming in on Wednesday and Thursday and Friday and Saturday that is being analyzed by the experts in Washington will give us a better idea if what we are doing now across the country is working. We have approximately, the latest numbers I saw is approximately 46,000 cases in the United States. A little over half of them are in the state of New York. Obviously, it has spread very quickly there. Governor Cuomo is working hard. I've been on calls with him as well. And the federal government stepping up by sending the actual military assets to help with that. We're going to continue to work hard to protect Mississippians. 1 second, she's got to follow up. Just 1 second, she's got to follow up.
Is there any consideration of a mandate to corporations, particularly those in manufacturing? We saw a case in Sanderson Farms, and I know they were reactive to that, but any kind of consideration given the fact that we have so many manufacturing outfits around the state who perhaps are not necessarily following the tips?
Well, certainly we are telling all of our businesses and others to follow. Just because you're in business doesn't mean you shouldn't follow the no more than 10 people gathered and that you shouldn't practice social distancing. I will tell you that in that particular instance, the federal government has identified those who are involved in the supply chain for food They're considered essential operations by all governmental entities, and so there are certain areas where some things could not be avoided. But we certainly say to all of our small business owners, our large business owners, follow the guidelines. No more than 10 people gathered at a time. Social distancing matters and is important. Yes.
As you said, you're still seeing people gathering for weddings and funerals and such. Do you anticipate a point where you may have to bring in law enforcement to monitor to make sure that people are, adhering to this executive order? Because if you put it out, no one pays attention to it.
Well, obviously, the enforcement mechanism of any executive order or of any law is challenging. We have laws on the books that says thou shalt not kill people, yet we have murderers that are arrested every single day. And so, yes, we are keeping all options open. We do have law enforcement. Our emergency first responders are working regularly and doing a great job supporting our efforts, and that's something that we will continue to see happen. So thank you. Right. So what we have done thus far is enter the executive order, which allows for individuals who are eligible for unemployment benefits to not have a 1-week waiting period. We have waived the requirement as well that you have to be looking for work. The next step that we're working to come up with on the executive order front is the potential to waive is to enter an order which protects our employers such that in these very challenging times we don't think that our employers should be penalized because if certain governmental entities or if the virus itself keeps them from actually providing the services, we don't think they should be penalized in terms of their unemployment rating, et cetera. We haven't entered that yet, but we're going to. In addition to that, we're really looking and waiting on seeing what the United States Congress does with respect to unemployment benefits and for those that are unemployed. Obviously, we have levers that we can pull that we have already pulled, but we also have an unemployment trust fund that is not limitless. It is not a bottomless amount of money. And so we want to see what the federal government's going to do because we don't want to do anything that disrupts individuals' ability to get paid and get paid quickly, and that's the reason we waived the 1-week requirement. But we also want to see the action that the federal government's going to take. This has got to be a joint effort of federal government, state government, and local governments. It has been said repeatedly that this is a situation and a crisis that has to be locally implemented, state managed, and federally supported. And so when you look at the unemployment side of things, federally supported is critically important because we need to understand exactly what they're going to do for American workers and for Mississippi workers, and we're going to do everything we can to lessen the burden on Mississippians. Yes, ma'am.
In terms of the unemployment, have you determined how many weeks they'll be able to get? Have you been able to look at how far out that can go?
Well, we're going to see how long. We're going to see where we are. What we've done is we've made it easier for those who are going to be put on unemployment to start receiving checks sooner rather than later. We have done that until the end of June. The executive order goes until the last day in June relative to the Department of Employment Security's calendar. And so we've got 3 months of that, April, May, and June, in addition to it starting in early March, so a little over 3 months of that. In terms of how long individuals can receive unemployment, we haven't made that decision yet because I believe the rules as they currently apply are adequate and sufficient to get us at least through the coming weeks and months. There's some data coming out from other countries as to how long it takes for for the virus to reach a peak and then start rolling over. It's incomplete, I would argue, at this point. I'm certainly not an expert on public health, but it seems incomplete at this point. But those are the kind of things that we have to monitor over time in making these decisions. I'm sorry, Emily, I can't see you.
What steps are being taken at this point to ensure the health and safety of people inside county jails and state prisons?
Yes. Great question, Emily. We have been in constant contact with the Department of Corrections. At this point, I am not aware of any positive case within our prison system. And again, this is an ever-evolving situation, and we will deal with that if and when it becomes known to us. We've been in constant contact with the Department of Corrections. I've talked to many sheriffs around the state. The actions that we have taken is we stopped the transferring of inmates from one facility to another. In addition to that, we have continued to significantly increase the sanitation within the prison system. We have also not allowed for outside visitation. Again, a very difficult decision to make, particularly given another crisis that we inherited at the Department of Corrections. But we felt the health and safety of those inside the system was necessary, that we cut off visitation. Not unlike, by the way, us advising no visitation at our hospitals, at our nursing home facilities, et cetera. We are working to make sure that public interaction is limited, and particularly limited amongst our most vulnerable population.
Follow-up question on that. There
Sure.
are hundreds of people in Mississippi County jails who are in there because they can't afford the cash bond that's been put on them, and they're pretrial, they've not been indicted yet. Is there any consideration of allowing some of those people, or maybe all of them, to get out to have more space inside the prisons, have people further apart, the jails better?
Sure. I am aware that is the case. We have not made a decision at this point to let anyone out of the criminal justice system. We continue to monitor that situation as well as many others, and if we find that is an appropriate course of action, we will take it at the appropriate time.
There's 9 Mississippi counties with no ICU beds whatsoever. What steps are being taken to make sure outbreaks in those counties are addressed and have access to ICU services?
Well, I think Dr. Dobbs answered that question earlier, but I'll let him come back up here and do that. We've got to make sure that we have adequate hospital beds and adequate ICU beds and adequate respirators and adequate ventilators statewide, and that is something that we are committed to doing. Some of the steps that have been taken, this, by the way, helps on PPEs as well. For instance, the guidance by the State Department of Health to not allow elective surgeries. One of the primary reasons that occurred was because of the fact that oftentimes elective surgeries take up equipment. There are, I am told in many of these, and I'll let Dr. Dobbs speak to this, the Vice President spoke to this a lot yesterday, but there are many ventilators, for instance, in elective surgery centers that with a small tweak can be retrofitted to actually act as ventilators that are needed in older people that have the coronavirus. We have worked with the Mississippi National Guard and are looking at the potential of additional hospital beds and hospital rooms that they may have the ability to help with, and those are things that we will continue to do. Dr. Dobbs, do you want to speak any further to that?
Thank you. So the normal sort of patient flow is to higher acuity care places. It's kind of like trauma, right? So people in the rural counties that don't have the specialized services needed will normally go to the normal referral course for higher levels of care. And so we're trying to augment those that exist already, because it's not just the rooms. A lot of the rural hospitals actually have space that could be used for intensive care, and some of them have talked to us about retrofitting it to provide that sort of care, but it's the staff. It's the trained specialty nurses, it's the docs who know how to do critical care. So we're working to augment that capacity so that people can get the best care where they normally would go if this were not the scenario. Thank you.
Yes, sir. What I said was I am unaware of any confirmed cases, and I'm not sure that there are. I don't have privy to the numbers of any testing that have been done either. I don't know the answer to that. But I'll get you an answer. So I don't know. Would you would?
I don't have any information to that regard at this time. I mean, we're always looking at stuff, but I don't have any verification of anything. Yeah.
What about schools, Governor? Is it too soon to say whether or not the school year is going to be done and kids are going to have to learn remote for the rest of the school year?
I would say it's too early to say. We took very aggressive action. First, closing the schools for a week, and then for an additional 4 weeks until April the 17th. As we move further along, there will be continued pressure by our education leadership to make decisions as soon as possible with respect to that, and we will. I have been briefed repeatedly on the number of innovative solutions that school districts are finding to make sure kids learn. I will tell you, one of the things I'm most proud of about Mississippi over the last 10 years is the significant improvements that we have made in education achievement and the significant improvements we made in educational outcomes for our kids. High school graduation rates up from 73% to 85%. We exceed the national average last year in high school graduation rates for the first time in our state's history. Our fourth grade reading and fourth grade math, our eighth grade reading and eighth grade math results on our nation's report card, 10-year growth numbers, we're doing better than any other state in seeing gains. And that's why closing our schools was such a difficult decision for me, because I see the hard work and the heart and soul that our teachers and our administrators and our kids are pouring into making educational gains in our state. But I will also tell you that the reports that I'm getting of the innovation that's being used in so many school districts to ensure that kids are still learning today. There's everything from distance learning to online services to teachers and bus drivers delivering school supplies to kids around Mississippi. The people of our state are stepping up. The people of our state are stepping up and making a difference. Now we want to get better compliance with the guidelines. We want to make sure that we don't have some people that are not adhering to the no more than 10 rule, for instance. We want to make sure that people, if you can stay at home, that you are staying at home. Not only because you're putting yourself at risk, but you're putting others at risk as well, and we want to make sure that we don't allow that to happen. Adam?
There's a national debate in several other states about how government officials believe what health experts are telling them about shut down, measures, that kind of stuff, versus potential economic effects of doing this kind of thing. You mentioned something about that earlier, and I'm curious just about how you personally weigh, what health experts are saying versus knowing that, if you shut down every business in the state for a period of 2 weeks, that might have a big economic.
Well, there's no doubt that the reality is, and when you think about those individuals that are making decisions in other states and maybe even in some other jurisdictions to mandate that businesses shut down and mandate that individuals stay home. When I look at that, I have to weigh the decision of, it's one thing to say we're going to do that for a week or we're going to do that for 2 weeks. But the question I think that needs to be answered when making long-term decisions is, if you're willing to shut down everything for a period of 7 days, are you willing to do it for a period of 7 weeks? Are you willing to do it for a period of 7 months? And what is the potential long-term effects? And it's not just the long-term effects from a money standpoint, how much money you have in your pocket to spend, but the long-term effects of the poverty that could cause and the public health effects of seeing a depression-like situation in our state and, quite frankly, in our country. And so what we're trying to do is follow the advice of experts. And as I've said earlier, and as I'll say again, both in our conversations with the experts at the CDC, at FDA, on the coronavirus task force. We have not been advised to do a statewide quarantine or a statewide shutdown. Based upon our conversations with our leading experts in Mississippi, not one of them has advised us that that is what we should do. And so while I understand that perhaps on cable news and other places there is a debate as to what that should look like, at least amongst the experts that we have in Mississippi, some of whom work with me, some of which work for me, and some of which don't fit into any one of those categories. But the ones that we are listening to, we have not been advised at this time that that is a course of action that should be taken. Yes, ma'am.
For Dr. Dobbs. Dr. Dobbs, what is your directive on daycare centers?
There have not been any directives to close daycare centers. Some private businesses have chosen to close. A lot of families have chosen to keep their families out of daycare, and certainly we have advised that everyone maintain those group limits, including daycare centers. That makes sense. Daycare centers are critical infrastructure. If we want to maintain those critical industries that keep us all alive and healthy, we need to have that access. We will continue to revise our guidance and try to make sure that we keep our kids safe. But it is a critical part of our infrastructure, and we will continue to work with those folks, but would never, mandate that, that they can make their own decisions as private business, of course.
Dr. Dobbs, I have
Yes.
one question, which was about testing. Do you anticipate that once we get past a certain point, we'll be able to ramp up testing to test more individuals as opposed to just
Yes.
kind of the specific? Can you talk about that a little bit?
More partners are coming on board to be able to test for this virus. The Department of Health is ramping up its own internal capability, but we really need to focus our efforts on our normal stuff, which is going to be hospitalized patients, outbreak response, certain targeted intervention in communities of high need. And so we need to get away from being sort of like the general target and that's happening, thank goodness. More and more tests are going to private labs. That's the norm. That's fantastic. And we also have other folks looking at adding testing, universities, and I won't speak for them, they can speak for themselves, but we're going to have a lot greater capacity. There are going to be challenges in the supply chain, just like there are for toilet paper and Q-tips. So, but we're looking at all kind of options to overcome those supply chain issues.
I believe it was at the end of last week you mentioned plus 6 drive locations led by the Department of Health in conjunction with
Yeah.
National Guard. What is the status?
So we're still planning for it. We're looking for resources to make sure that we can man those properly. The locations may vary based on the need, and so we're seeing where we have partners like UMC who's going to do this drive-through clinic, and really excited about that. There's the capacity there, but if there's a county somewhere that has a lot of cases that they don't have rapid access to testing, that's where we need to be, and we're ramping up for that to happen. Thanks. Thanks.
As the situation develops, what do you see as the role of the National Guard, both now and as
Well, I will tell you, our men and women in uniform have answered the call at every time in American history, and I know that they will do so again in this crisis, should they be needed. They're currently focused on humanitarian efforts in supporting the Mississippi State Department of Health, for instance. Once we get more testing sites set up, they were very engaged and involved over the weekend in making sure that these PPEs got distributed out to EMAs and hospitals throughout Mississippi. I can't tell you how many hospital administrators and others I've heard from over the last couple of days and just thanking us for our ability to get supplies to them first Saturday and then again on Monday. What I will tell you about General Boyles and his team, and I'll turn it over to you if you'd like to speak, I have full confidence that anything that we need them to do in my direction, they will step up and answer the call. So, General Boyles.
The Mississippi Guard recognizes that the Mississippi State Department of Health is the lead in this event, and so we're partnering with MEMA to provide logistical support, and that might be on-the-road support, that might be doing planning, that might be providing facilities if needed for this event. We also do a very good job of providing security in places like a testing event where people are doing testing, and we have to really just help with traffic control, if nothing else. And then we also are a conduit for the governor to the active duty installations. They also have to respond to this event. And so we are the conduit for Dr. Dobbs and the governor's conversations with those installations. And we are helping them address their concerns with the governor also. That's all I've got, Governor.
Let me just point something out. General Bowles mentioned it, and I want to say it as well. They are my conduit to our active duty military places such as the CB base, the NAS Meridian, Columbus Air Force Base, etc. And they're doing a fantastic job with that. The U.S. Army Corps of Engineers in Vicksburg. I did do a call with General Bowles and others with the commanders of every one of those installations. Sometime the days run together, but sometime in the last several days, they are doing exactly what they should do. They are working hard to protect our men and women, and they stand ready to assist us. And that's something that I want to be clear, that we are reaching out to every potential partner to make sure that in the event that things get to a point where we need to do more, we need to do even more than we're already doing, that we have partners in place. That's the reason we're looking at, General Bowles mentioned facilities. We're looking at potential facilities that in the event that we find ourselves in a worst case scenario for hospital beds, et cetera, that we have capacity that we can deal with that. We are going to, we are doing more planning right now for a week from now and 2 weeks from now and 4 weeks from now in the event that we find ourselves in a situation. One thing I will tell you, and this is not something that I really want to brag on, but Mississippi has been through unprecedented natural disasters time and time and time again. It's been a little bit interesting for me, being that I have been here on this one square block in downtown Jackson over the last number of days. And it's been a little bit ironic because I've spent most of my time, and you've seen me on Facebook Live, in the conference room. If you'll recall, in August of 2005 when Hurricane Katrina hit, downtown Jackson, and including the building that I was working in at the time, didn't have power for many days. And I spent many hours and many days leading up to what ultimately became a special session in late September, working with Governor Barber and his policy team in crafting measures to help the state recover from that. And so I spent the same amount of time, it seems like, back in 2005 after Hurricane Katrina that I've spent in that very same office here at the residence, and that's something that has really been ironic. It's been interesting. It's been a little bit eerie, but it is what it is. And I'm committed to doing everything in my power, just like we did after Hurricane Katrina, is recovering in this state, returning bigger and better than ever before. Absolutely, I think it's possible that is the case. I'm not taking anything off the table at this time, but I do believe that we have a lot of things that are going to be presented to us in terms of information and data, in terms of where we find ourselves. And what I want to make sure that everyone in Mississippi knows is the most likely scenario for us to not have a statewide stay-at-home order is for people to do what they need to be doing right now, which is staying at home unless you provide essential services. You know, for some, and I've seen some folks that are criticizing various decisions that have been made, and let me just be clear, this is not a time for politics. This is not a time for criticizing our leaders, no matter what decisions they make, because there's a lot of people under a lot of stress. But what I will tell you is this, you know, for some they believe, well, this should be easy. We should just have a statewide stay-at-home order and shut down all daycares, for instance. Well, my question to the people of Mississippi and to all of you is, if you shut down every daycare in the state, who's going to provide for the children of the healthcare workers that we depend on to go to the hospitals? Who's going to provide daycare for them. Some may have family members, some may not. And the fact is that we need to find ways to be smart, to be intelligent, to do exactly what we've been advised to do. But we also have to understand that there are literally thousands and thousands of Mississippians that are providing essential services to care for the sick, to make sure this doesn't get worse than it already is, to make sure that we have the care that is needed at our hospitals, at our doctor's offices, at other places. And I want to say to all individuals that are in essential services, and particularly to our healthcare workers that are on the front line, thank you. Thank you for what you are doing. You are making a difference in our state, and we appreciate you. Well, we have given every executive director of every state agency the authority to make decisions based upon what's in the best interest of those state agencies, their state agencies. They know far better than we do who is essential and who is not. As you know, in Mississippi, there's a fairly small percentage of overall employees actually report directly to the governor. But what I have been advised of in talking to agency heads over the last several weeks is a large number of them are in fact working from home. The essential employees, I mean, obviously the State Department of Health, the Mississippi Emergency Management Agency, the National Guard, others are doing everything in their power, as they often do, to step up in this time of crisis and of challenges. And I commend every single one of them. We've got some incredible state employees that are bending over backwards. And I tell you that because I know, because I've talked to them, because I've listened to them, because I do conference calls with them. What seemed like at 7 o'clock in the morning and 7 o'clock at night, and then we'll talk for a few, something like 12 hours in between, and then we'll start and get up and do it again the next day. We've got incredible people that are doing everything in their power to help their fellow Mississippians, and I couldn't be more proud to be their leader. It's a. Well, I'm not aware of anyone who fits that category. I'll certainly look into that. We have given our agency heads extreme discretion, but the core functions of government certainly have to carry on. We've got to, in these difficult times, we certainly use your example. We have Medicaid eligibility workers that are working. Of course they are, because more people that are becoming unemployed are going to become eligible for benefits, and we need to make sure they get the benefits that they need.
Governor, this question for Dr. Dobbs. I understand that there's some companies like Delta and Gene Company that are revamping face masks. What process do they have by which you have them certified for use?
Yeah, what a great question. This is a good example of Mississippi finding Mississippi solutions. It depends on what you're talking about. If you're talking about a gown or a surgical face mask, the requirements are much less than an N95 that has to be fitted. So, we're looking at all options. We have universities making their own viral transport media to make up the deficit. We have people making swabs de novo. So there are great things happening in Mississippi where Mississippians are taking care of each other. And if we can find stuff locally that meets the need, we're going to take advantage of it. Yes, sir.
I'm gonna also bring up Greg Michelle with respect to this, because I know he personally and I personally spent a good part of the weekend not only distributing supplies but also making phone calls, trying to work our contacts in the traditional supply chain. When we recognized that that given what was going on in New York, that we would not be at the highest priority for the national stockpile, we knew that Mississippians had to step up. And he has a great team at MEMA that has been fielding those calls. They understand procurement, and they've done a fantastic job as well. So I'm going to ask Director Michelle to speak to this.
So back to the point about the mask, we're having to use somewhat unconventional methods by which to procure supplies. The national stockpile and that process is going pretty much prioritized to those states that have got the most number of cases: California, New York, Washington. That being the case, we're having to acquire these things through the commercial sector. Most of those stockpiles and the inventories as such are going to that national stockpile, so we don't have access to that. So you're seeing things like plants retooling and manufacturing masks where they may have been manufacturing another garment. CDC has given guidelines about what things would work, and those manufacturers are working to meet those guidelines. Eventually, what the intent is for these Mississippi organizations to be able to ramp up their operation so that we can divert some of the procurement processes to our Mississippi businesses and keep them employed during this process.
Quick follow-up to the earlier question. So the nations that have kind of flattened this curve, as we're seeing now, you have China and then also Italy, which have done this intense lockdown with majority tourists. And then you have something like South Korea, where you have mass testing and pinpointing. We're not quite following either of those models. So this is a question for any of you. What model are we following to actually reduce the spread of this thing and to hit that peak before it gets too high?
Yeah, what I would say about some of the other countries is that when you look at actual when the virus really started to spread in comparison to when they started taking any measures, what I would tell you is that we probably, as a country, and this is not true of every single city or every single state or every single region, but as a country we're started the process of taking very aggressive action. If you look at the guidelines from the CDC and from the Coronavirus Task Force, from the federal government, the 15 days of social distancing and other things that we have reason to believe may be helping to slow the spread. The data is not complete or sufficient at this time, but those are things that we as a country are doing. And when you look at where Mississippi is, I think when you compare what we've been able to do from a testing standpoint, due in large part to the State Department of Health stepping up and doing tests. We haven't administered nearly as many tests as we would have liked to have, but when you look at how many we've administered compared to many other states and their per capita numbers, one of the reasons you see Mississippi having more cases than some states, at least partially, is due to the fact that we've tested more people. And that's not true across every single state. But you know, this is a disaster, an emergency, unlike any that I think anyone has been through. Because you think about, and I know General Bowles was involved in the Katrina response from the Guard when he oversaw the coastal counties for the Guard at that time. This is so different from that because in the supply chain for supplies, for instance, then we had the full support of the federal government. We were competing with Louisiana and a little bit in Alabama. But now on so many of these supplies, we're competing with every other state, with every hospital around the country. And that just creates even more challenges. Emily, you had another question?
Actually, I have 3 questions.
Can you go one at a time? Because
Yes. Have you or your family been tested? I know you came back from Spain and you self-quarantined for a while.
No one. My wife, my 3 daughters, and I, none of us have been tested. We have taken doctor's orders and taken our temperature twice a day now since we got back. But remember, we're trying to lead by example, and that's the reason we self-isolated. But in addition to that, we're also trying to lead by example by saying this. If you don't have a fever of 100.4, if you're not a healthcare worker, if you're not currently hospitalized, we need to prioritize testing as we ramp up, and we are ramping up. We're doing more and more every day, but as we ramp up testing, we need to prioritize for those who have symptoms. We need to prioritize for those who are currently hospitalized. We need to prioritize for those who fit in the category of the more vulnerable populations, those over 65, those who have compromised immune systems. And I know I say that a lot, but I mean it. But to answer your question, no ma'am, no one has been tested.
My second question, totally unrelated to the first one, and either you or Dr. Dobbs might take this. Abortion.
abortion. There are governors in Texas and Ohio who are saying that those are considered elective surgeries and should not be done. Does Mississippi have any directive on that with the single abortion clinic in the state?
Well, I'll let Dr. Dobbs answer this as well, but what I will tell you is, from my perspective, we're doing everything in our power and have for many years to make Mississippi the safest place in America for unborn children. It is without question that the lone clinic in Jackson does in fact operate doing procedures that are elective and not required, and therefore they should be following the guidelines as offered by the State Department of Health. And if they are not, I would be prepared to try to take additional action to make sure that they do so. Dr. Dobbs, I don't know if you want to. You may know more than I do.
Yeah, that's something that I was not familiar with, and before I would make any comments, I think we'd have to review the situation a little bit more. Thank you.
Governor, what additional action would that be?
We'll take whatever additional action we need to protect not only the lives of unborn children, but also the lives of everyone who may contract this particular virus. The reason that Dr. Dobbs and the State Department of Health has reduced the number of elective surgeries and elective surgery centers, of which I would argue that that the clinic is one. And again, I don't know any specifics, and so I'm not saying that they are currently operating. I just simply don't know because I haven't really been much off this one block in downtown Jackson in a number of days, so I haven't seen it. But we'll take whatever necessary actions. The reason those elective procedures are shut down is not because we're trying to say anything other than we need to protect our PPEs, our masks, etc., and other supplies for anyone who gets affected by this virus. You have one more question?
Yes, my third totally unrelated question. There are people in this state, significant portions of the population, whose primary language is Spanish or whose primary language is Vietnamese. What efforts is the state making to reach out to those communities to make sure that they're receiving communication so that they can understand what's going on?
Yeah, I think that's certainly something that's important. We want to protect all Mississippians. We believe that we need to get information to all Mississippians, and while I don't know of any specific actions that have been taken, that is something that I'll look into and get back to you. You want to answer?
Yeah. And we've been working on it somewhat, but we need to do more. We've been putting things in different languages, but we do need to do more with the call center.
And I'm going to let Director Michelle address this as well.
I appreciate you bringing that point up. It was actually brought to our attention, and it is something that we had not integrated into the plan, but we, as effective as last night, we've got some material that will be going out. We'll be connecting with Mississippi Department of Health. In our warnings and our alerts and our CDC guidelines, we have translated that material into Spanish. We want to make sure that our Hispanic population in the state of Mississippi gets those warnings as well. But that, again, was brought to our attention last night, and we reacted to that immediately, and my communications director, in conjunction with the Guard and the Mississippi Department of Health, will have that to put it out.
Dr. Dobbs, I know that we heard Dr. Reeves talk quite a bit about the tomatoes of the shutdown, and he talked about hearing from experts and also weighing all the decisions. What are your thoughts? What have you been advising the governor on as it relates to this?
It's really a tough conversation, and something, I know the governor's not taking anything off the table. There's constant conversations about what are the best tools in our tool belt to take care of the situation as it is. Understanding that whatever decision you make now is going to have implications for days and weeks down the road. And I think that right now the governor's hitting the sweet spot, but I know that there's things that need to happen probably down the road. So we'll continue to evolve along with his guidance. Thanks.
When you say things that need to happen, like?
Yeah, so we've been under a resource-constrained environment, right? We haven't had access to testing, we haven't had access to PPE, and as we sort of fill out those resource issues, we'll be able to ramp up testing. We'll be able to improve our epidemiologic response capabilities. We're ramping up our teams, adding nurses, adding epidemiologists. So there's a lot of stuff that we can do to sort of respond more aggressively once we get these resource issues fixed. And you'll see a lot of activities. Some of the core bread and butter things we know that works. Once we get the capabilities to do so, we're going to launch more activities.
Follow up, you said that as Wednesday and Thursday roll around, we'll start seeing the results of testing after some of these voluntary quarantine measures are taken. We still see
Well, I think that when I speak towards the more data that's really more nationally, and that comes from a conversation that we had yesterday with the Vice President and with his team as they look at the data nationally, and they're going to make decisions as to whether or not the President's 15 days to slow the spread is working or not. I think it's really more nationally than it is in Mississippi. I want to be clear about something. We don't know when this is going to end, but we do know it's not going to be later this week or this weekend. We're not going back to normal on this weekend. These guidelines are going to be in place for a period of time. People need to understand that. People need to get prepared for that. And so I expect for the number of cases to continue to rise. But please understand that because the number of cases rise in the short run does not mean that we are having significantly more spreading in and of itself. It just means perhaps that we're testing more and we're doing more testing and getting more information. Remember also, there are literally over 100,000 people across the globe that have had the virus and have fully recovered. And so there are approximately 15,000 people around the globe that have had the virus and passed away. And I mean, these numbers are obviously, that is a number that is far too high. But I don't want anyone to walk away from this briefing thinking, well, if I get the virus, I have no hope, because that's just simply not true. It seems to be much more deadly in older populations, in those who have compromised immune system. I don't know, don't quote me on this because I don't know that it's true, but I did hear someone yesterday that should have accurate data that said the average person that passed away in Italy was over the age of 80, the average age of those who passed away. Again, I don't know that that's true, but and while it may not be true, what we do know is those who have compromised immune systems and those who are older are more susceptible to getting very, very, very ill. That is the reason that I repeatedly say, if you are fit into one of those categories, please stay home. Please stay home. One of the things that we are looking at is, and I will tell you, I have advised so many people of that to please stay home. You've seen some states that are very reluctant to do statewide stay-at-home measures, that perhaps have done some statewide stay-at-home measures for those in the vulnerable populations. Again, what I am saying to those that are over 65 that have compromised immune systems, you need to take further cautionary measures. Obviously, social distancing and avoiding groups of 10 or more we think has a potential of slowing the spread in Mississippi. But for those of you in the vulnerable populations, please do even more.
Governor, just to make sure I remember earlier about executive orders you read on science after, those are going to ban groups of 10 or more, ban dining in a restaurant. Can you just again go through exactly what?
Well, we'll issue the executive orders later today. What I am saying today is Mississippians, stay out of groups of 10 or more. Mississippians, if that means not going to restaurants, don't go to in-dining restaurants. Take out, carry out, even home delivery potentially, but do not go into restaurants that have more than 10 people in them. What I am saying to Mississippians today is don't gather up on the beach with groups of more than 10 people. Just don't do it. It's not good for you, and ultimately, even if you are happy and healthy, you may contract the virus and then unknowingly even give it to someone who is in that vulnerable population. So again, stay out of groups of 10 or more. Wash your hands. Practice good hygiene. Continue to monitor where you are from a health standpoint and stay away from large groups. We'll issue the order later today, and what I'm telling Mississippians is please stay out of groups of 10 or more. Do not put yourself in harm's way. Do not risk putting yourself in a category where even if you were to contract it and get over it, that you put someone else in harm's way.
But again, you can't say whether or not that's going to be executive.
I haven't signed the order yet, but as soon as we complete it, we'll put it out to you and to your colleagues. So. Thank y'all. Appreciate it.